Thanks everyone for joining us today for this recorded presentation. We're pleased to be here. My name is Bonnie Jeffrey and I'm here with Michelle Harasny, who's our project coordinator. And we're going to be introducing you to a newly funded project here in the province, Interventions to Enhance Social Inclusion of Older Adults with Dementia in Saskatchewan. This project is funded by the federal government through the New Horizons for Seniors program. And the overall purpose of our initiative is to implement and assess multi-level interventions to support social inclusion and reduce stigma of older adults with dementia and their care partners. And in our particular project, we are focusing especially on the needs of those that are living in small cities and rural communities in Saskatchewan. So our project is looking at funding, implement, and interventions that can support services and other supports at different levels, all of which are, have the goal of increasing support and reducing stigma. So there are individual level supports for those with dementia and their care partners. For example, this could include things like support groups, individual supports for people, etc. Community level supports that are aimed at public awareness and reduction of stigma. And this is really getting at the whole issue of enhancing people's knowledge and understanding of dementia. And finally, organizational level initiatives to increase support for clients, customers, and employees that are living with dementia. The thinking there is that, if somebody's in a local co-op store and staff are trained in terms of how to appropriately support and work with one of their clients or their customers who has dementia, that this will result in greater inclusion. So why did we choose smaller communities? Well, one of the reasons is that these communities are often characterized by a lack of local services and supports that can address dementia care. And also because of this lack of supports and resources in many rural communities, there's a real need for intersectoral interventions. Interventions that can bring together partners at different levels of organization, community, and individual responses. Some of the barriers and challenges that we identified when we were developing this project was that there is a real lack of knowledge and awareness about dementia. And there's also a lack of knowledge about how to continue supportive relationships with those affected by dementia. So sometimes people are just uncomfortable. They're just not sure how to relate to somebody that they know has dementia. And then finally, there is a lack of knowledge about the specific tools that communities and organizations can use in order to foster a more inclusive environment for those with dementia and their care partners. I'm leading a project team that is operating under the Saskatchewan Population Health and Evaluation Research Unit, which is a bi-research unit between University of Saskatchewan and University of Regina. Our team are all based at the University of Regina. I'm a social work professor. I'm based at the university's campus in Prince Albert. Dr. Tom McIntosh is a professor in politics and international studies with expertise in health policy. And Dr. Novick is also a professor with the Faculty of Social Work based in Regina. And we have Michelle Harasny, who's been our project coordinator since November. And we will have a full-time evaluation coordinator who will be coming on very shortly onto our project. So with that introduction, I'm going to turn it over to Michelle to give you a little bit more detail about the project.
Hi everyone, I'm going to talk about Sphere's role as the backbone organization. A bit later on, Bonnie's going to explain more about what backbone organization means, but I'm going to highlight a few points about Sphere's role. We developed the process for funding organizations, which included posting an open call for project ideas on our website. And we provide continuing communication, ongoing support between the collaborating organizations, as well as we support alignment of activities across the organizations, and we provide overall guidance and leadership. We're also responsible for coordinating the evaluation, the data collection, and reporting to our funder, ESDC. We decided to select Yorkton and surrounding rural communities as the focus for the initiative. We would have liked to include all communities across Saskatchewan, but it just wasn't possible to do so, so we have focused on Yorkton and surrounding areas. With the vision that we'll take what works from this area and transfer it to other communities across the province. It was necessary to do a virtual launch of the initiative in the early spring because we couldn't meet in person in Yorkton. And we plan to have more community engagement through a local community table, which will involve people from rural communities. This shows the project area. It's the general area of Yorkton and surrounding communities. It doesn't have formal boundaries. This is the general area that we're looking at. And the project approach is to fund 3 to 4 collaborating organizations to deliver interventions that address one or more of the levels of interventions. As Bonnie mentioned, the levels are individual, community, and organizational interventions. They will involve partnerships with other sectors or organizations, really highlighting the collective impact approach, and agree to work within a collective impact approach to delivery and assessment of the intervention effectiveness. Bonnie's going to explain more about collective impact. It is such a central part of the project. Over 100 organizations from Yorkton and surrounding areas were invited to participate in 4 information sessions using Zoom. These information sessions were recorded and are available on our website. So if anyone wants to have a look to find out more, you can go to our website and look under the Community Presentations tab. Out of those 100 organizations, there were several that were very interested in creating an intervention or working with another organization on an intervention, and we've been in touch with those organizations over the past few months. They are the Yorkton Public Library, Parkland Valley Sport, Culture and Recreation, the Alzheimer's Society of Saskatchewan, SIGN, which is the Society for the Involvement of Good Neighbors, as well as Saskabilities and the City of Yorkton. We are conducting a pre and post survey, so 2 surveys, one at the beginning and one at the end of the project, on local knowledge and stigma related to dementia. These are telephone surveys conducted by the Social Sciences Research Lab at the University of Saskatchewan. The pre-survey will help inform project development. Already in the pre-survey, there were 404 respondents, and we are currently looking at an analysis of the pre-survey, which will be turned into a report that will be posted on our website in the future. And in 4 years, we'll do a post-survey, which will allow us to measure any change in knowledge and attitudes over the past, or over the years in between the 2 surveys. This is a picture of our advisory committee. We met at the end of February in person, and and since then we've been meeting virtually. The members of the advisory committee have a variety of experiences and skills, and there are people on the committee with lived experience, as well as people living in Yorkton and area communities, and practitioners, working practitioners.
Okay, thank you, Michelle. So just to summarize, we received the funds from the federal government, and part of our job is to provide a facilitation, coordination, do the evaluation, but we're also the ones that we're able to distribute funds to organizations to deliver interventions that we've outlined earlier. So, you know, we had great plans to really get launched. We were slowed down because of COVID and the need to do a virtual launch, as many people were in terms of their work. But we have been able to really determine that there's a lot of interest in Yorkton, from the Yorkton organizations and working with us on this. So Michelle mentioned earlier about this collective impact. This is one of the central features of the funding that we are required to do. And so I just want to give you a little bit of a definition and a brief overview of what it means. But if you think about how we deliver services in many ways, often we use what's called a silo approach. An organization has their clients, they deliver those services. They might have communication and some interagency meetings, but this approach takes it a little bit further than that. It's an upfront agreement for different organizations from different sectors to work together on solving a common issue, right? But it's a very structured form of collaboration. So by different sectors, you know, in our example, we're bringing in sport, culture, and rec, the libraries. So it's not just health and social service types of agencies. There's 5 key components of implementing this different type of approach of organizing and delivering services. Everybody has a common agenda and agrees to it. There is what we call shared measurements. There are mutually reinforcing activities. There's continuous communication amongst the organizations, and there is this backbone support, which Michelle introduced a few slides ago. So basically what it means is we work with these organizations. We facilitate bringing them together to talk about the overall vision for change related to supports and reduction of stigma for dementia and their care partners, people with dementia and their care partners, to really work together as a group to come to a common understanding of the problem, and then most importantly, to really agree to a joint approach and what actions that these organizations will collaborate on. I mean, some organizations will be doing community level interventions, some might be doing individual, but the idea is to really bring them together to intentionally talk about how they work together. The shared measurement, that's really our job as the leads of the project, that there will be continuously throughout the project. We will be assisting these organizations in collecting data, analyzing it, in terms of measuring results. And the idea is that this is done consistently throughout so that there's constant feedback of, well, this doesn't seem to be working, so let's try something else. Thirdly, there are what we call mutually reinforcing activities. So each of these organizations may be delivering different activities, like some may be delivering an individual support group, some may be delivering a public campaign to increase awareness, but it's still about coordinating all those activities together. So how do they link up? And again, our job as this backbone organization is to help facilitate that throughout the project. Fourthly, to establish a clear communication strategy. So our communication strategy is around communicating our work to the general public. We have a website, we have a Facebook, we have a Twitter account, but also to consistently be supporting communication amongst these organizations. So in other words, we don't just sort of approve and distribute the funds and then say, see you in 3 years. We're going to be actively engaged throughout. And then finally, this term backbone, odd term, but it's the term that's used in this particular model and used by the federal government. And so we are what's called the backbone. We have the funds, we're responsible for reporting on them, but we get some resources which allows us to have dedicated staff to support this initiative. And Michelle is our full-time project coordinator. She will be the one that will really be maintaining communication with these organizations throughout. She handles our knowledge translation products, our website, etc. And of course, we will be having a full-time evaluation coordinator who will work directly with organizations. We recognize that adding evaluation onto the backs of organizations as they deliver a service is sometimes a bit onerous, especially for small organizations. So we're there to provide that particular support. And then really our job too as the backbone is really overall coordination and you're kind of moving this approach along as much as we can. So to date, we're really pleased that even with the virtual launch, we've been able to determine 2 collaborating organizations who will both be receiving funding. The first one is Parkland Valley Sport, Culture and Recreation District. And the overall objective of their project is to conduct a needs assessment in Yorkton and surrounding rural areas in order to provide some foundational information for priority interventions. So when we were meeting with the organizations in Yorkton, they mostly said, look, we can't just jump into picking an intervention because we really want to know what do people really need, especially in the rural areas, and how best can they access that. So there was a decision made by the group that the first thing to do was a needs assessment. So we have funded Parkland Valley to do that. They're in the process of starting that. They've hired someone, and we expect the findings from that to be coming back late November, early December. And then we'll meet with organizations again to say, okay, here are some of the priority interventions. Are there any organizations who would like to pick up on that to deliver those? The second organization that we've confirmed is with the Alzheimer's Society of Saskatchewan. And some of you might be aware that they do have a full-time First Link coordinator in Yorkton now. So they're able to really expand some of their services through that person. But this will add some additional resources to the Alzheimer's Society in order for them to really focus on that community level awareness. But it affects organizations as well, around building general awareness about dementia, reducing stigma, facilitating the involvement of these local organizations, businesses, and really promoting the concept of dementia-friendly community initiatives. So that will be another project that we will be proceeding with, working with them on that. And just for information, we are hoping that as the years go by, that these projects will be reporting on their findings and their progress at the Dementia Summit, and so that we can really do some networking and linking up with people in other rural communities throughout the province. So thank you very much. A very brief overview about our project. Please, we'd be most happy to hear from you if you have any questions or comments. If you would like to be on our newsletter list, Michelle is doing a regular newsletter which provides updates. You can visit our website at this site here. And there's a link there for you where you can check out the community presentations we've done. And you can also sign up for our newsletter so you get regular updates. But also happy to hear from you via email if you have any questions at all. So thank you very much. I'm sad that I'm not able to be there in person, that we're not all able to be there in person so we could meet each other. I always look forward to that event every year. But hopefully next year we'll see you face to face. Thank you.